Hello, everybody. Welcome. Thank you for coming. The lady in the photograph that you see up there next to me is the same lady that's standing right here next to me. She happens to be my wife, Mary Ellen. She happens to be a counseling psychologist, and she's a grief counselor at hospice. And I'm one of the physicians who works at the pain clinic. So thank you for coming to this sequence on the psychology of pain and an introduction to cognitive behavioral therapies. We've called this thing the psychology of pain, and we've given you an airplane as a symbol because you'll see why in a minute. Because this program is all about a 1-degree course correction. This is our signature description of our program. You cannot take a jet plane and turn it around in 5 seconds. You cannot take the Queen Elizabeth and turn her around in 5 seconds, but you can say to the pilot, can you make a 1-degree course correction? And he can say, or she can say, yes, we can. And if you take a 1-degree course correction from Vancouver, instead of going to Quebec, you'll wind up in Boston. And that's what this program is about. It's about incremental, small, baby steps, which over time will get you to a different place. It's compatible with what we know as complex systems. You can't move complex systems quickly. You've got to make small, little changes, and you've got to be able to stay the journey of the course. Because if you get off after 45 kilometers, you'll still be on the same direction. You've got to stay the course. So this little metaphor is about being willing to make a 1-degree course correction and stay for the whole journey.
But we also want to point out that it's kind of a message of hope as well, because 1-degree course correction is very subtle, but over time, that little change can make a huge difference in your quality of experience. So we are going to be offering you a lot of different possibilities for strategies, recognizing that you all have strategies right now that you're using. And quite honestly, a lot of them have been successful because you're sitting here. So it's not that we want to revamp. We're not going to ask you to make huge change here. We're going to talk about subtle changes, recognizing that very small change can really make a difference over time. The other thing just to be aware is we're always inviting you. We're inviting you to trust yourself, to be discerning. We're going to be presenting a lot of information. And some of it will fit, some of it might not fit for you. And it's really an opportunity for you to get connected to, does that resonate with me? Does that feel like that's something that might work? And I'm sure that all of you have heard of a lot of the things that we're going to talk about already. For an example, I know for myself, I've gone to yoga classes. And yoga's supposed to be great, right? But when you go to a yoga class and a 19-year-old teacher walks in, and she weighs about 90 pounds, and she starts telling you, the kind of position that you should get in that's going to be helpful to you, and you take one look and say, you know what, I don't think that's going to work for me. So what we're hoping is that you can recognize that everything that we're going to be presenting, there's many different variations of it, and so some of it you might have already tried, but just to be open. Be open that, for example, things like yoga, there's, Iyengar yoga, and there's yoga for people who want to turn themselves into pretzels. But there's yoga for people who have chronic pain. And again, a very slight, subtle 1-degree course correction can make a huge difference. So always remember, we're inviting you. Try it out. If it doesn't feel like it fits, you can leave it here and just wait. Even one thing that you pick up in these weeks can have a difference on your quality of experience over time. So that's our hope for you.
I'd like to acknowledge some people. This program would not have happened if Paul Etheridge didn't found the Okanagan Interventional Pain Clinics. He was the one who brought us all together, and he is the key guy who has supported us into this program. We wouldn't be here if we didn't have these 3 wonderful ladies who ran our clinic. 2 of them are here. The third one is struggling with the office right now. And
Sorry.
this is a picture of Neil Pearson. Some of you know Neil. He's got a website. And Neil used to run a program here with us on his physical activity levels. And we're going to refer back to his work in a little while. Next. And these are the characters that you may or may not see as you come by the clinic. One or other or more of these people will have seen or attended to you. Next. And on the left is Pam and Owen, her husband. They are Vancouver, Surrey-based physicians who come once a month to our clinic. And the two of them, along with Neil, published a very interesting what they call the personal toolbox for the chronic pain patients. Now, the toolbox is very complicated. Don't take notes just yet. But the toolbox reaches out to all these areas. To make it simple, I've taken all those fancy words and put them into simple keys. Now, this is your toolkit as a chronic pain patient, as described by Pam, Owen, and Neil. In the middle, he talks about the toolkit and your interdisciplinary pain team. And that includes all of those people who treat you, whether it's from physiotherapy, psychology, physicians, social workers, everybody in the team. Now, to the left, you see they've got the psychology program. So theoretically, that's the box that we're going to fill in for you. But if you go above that to knowledge about pain, we're going to provide you with knowledge about pain. We're going to help you optimize sleep, because many of you suffer from sleep disturbances because sleep abnormalities in pain patients is common. We're also going to talk about lifestyle changes. To the right, gathering support. Thank you for all of you for bringing support people. You've already learned the most important lesson we can teach you, namely, gather support. At the bottom right, it's mindfulness and yoga and breathing. We're going to talk to you about all of that. And the gentle exercise quadrant, we will refer you back to Neil Pearson. So you see, the psychology of pain covers everything, let's face it, eh? So that's what we're going to try to talk to you about. So in this program, because we have a lot of people, it's going to be more on an educational basis, not an individual therapy process. It's too large a group to take on in a therapy context, but it's not too large a group to use it as an educational forum. And so it's about information, it's about understandings, and it's about tools that we're going to give you that you can work on a daily basis. So when we began putting this course together, we asked ourselves a very simple question: where do we begin? And the answer, of course, is you. So, where do we begin? Well, we begin with you, because you're chronic pain patients. You've come to this process. And so we would like to know a little bit about you, and we would like to know what needs you have and how we can try to meet you at that level. Now, we have a little bit of a head start here. Can you hear me now?
Yes, thank you.
We have a little bit of a head start. Because there was a publication in the Canadian literature in 2010. It was called the Canadian Stop Pain Project. And what they did was they surveyed 728 patients from 8 centers across Canada that were on waiting lists to be seen by various and sundry chronic pain patients. And they surveyed these people. So they would be representative of you. And 2/3 of them scored severe pain at 7 or more. I know that all of you, or some of you, can relate to that. Next. What was quite startling was the incidence of depression, anxiety, and anger amongst patients with chronic pain in Canada. 50% had moderate to severe depression. 2/3, 67%, had moderate to severe anxiety. And half had moderate to severe anger. So this gives us a little picture of who the chronic pain patients are. So with great respect to all of you, we acknowledge these factors which go along with the phenomenon of chronic pain. So there's this triangular relationship that seems to exist between depression and anxiety and anger. And the common denominator between depression and anxiety is fear. And depression, anxiety, fear drives people towards, of all things, anger. That may sound like a strange place to default to. And it is strange, but it's actually common in everyday life. You see, a number of years ago, I took my daughter Rebecca skiing at Whistler. And we headed up the hill and we skied all day. But about 3 o'clock in the afternoon, I said, Rebecca, I'm done. I'm toast. I'm out of here. She said, I'm not. I'm going to keep skiing. Fine. So I'll meet you at the bottom of the hill. So all was good. I went down the hill and it was great. And at about 5 o'clock, it was starting to get dark. The gondola was coming down. People were unloading. I was waiting for Rebecca. We didn't have cell phones in those days. And I waited, and the people came off the gondola, and I waited, and then it slowed down. There was a trickle, one got off, the 3 or 4 gondola cars came down with nobody on, and then another one. And then finally, it stopped. No Rebecca. And then I watched the gondola operator switch off all the lights and disappear. And now it was dark, 6 o'clock, dark, and I was in fear for her life. My God, what's happened to her? I was in a state of fear. So I rushed around. I went to the local hotel. They said, well, we don't know anything about that. We're the hotel. And I rushed to the ticket booth. They'd all closed up and gone home. I went across and I went to the RCMP office. I said, hey, what's happened? My daughter's up at the hill. They said, well, we've had no report of any incidents. There's been no report of anything abnormal happening on the hill. I'm sorry, we can't help you. So about 7 o'clock, by 7 o'clock, I was quite desperate. I had imagined all of the worst things that could have happened. And at about 7 o'clock, suddenly, I was standing there just not knowing what to do. I was fearful for her life. And then, all of a sudden, I saw the gondola man walk back. And all of a sudden, the lights all went on again. And then the gondola started running. And I thought, oh my God, what's happening? And then 2 cars came down and about 8 people got out. She was one of them, all smiling, laughing, having a good time. I thought, my God. What happened was the gondola had derailed at the top. Nothing bad had happened. They were sitting in the comfort of the warm cafe at the top of the hill having hot chocolates, having a lot of fun. And then they fixed the gondola, then they came down. But what's interesting was I was furious. I was outraged. I was angry. I couldn't contain my anger. It was fear that drove my anger. So you see, if only I had known that they were sitting comfortably in the coffee shop, I could have waited all night. If only I had known that the gondola was being fixed up. If only I had known. See, there's a role for information and understanding. If I had known and understood that there was nothing bad happening, they were quite comfortable and warm drinking hot chocolate at the top of the hill with their friends, I would have been fine. But I want to capture the thought, if only I had known. So that brings us back to this triangular association between depression, anxiety, and anger. There is a role for information and understanding, if only I had known. So one of the objectives of this course is to provide you collectively and your support people. Thank you for coming, support people. We appreciate you. we're going to try to provide information, knowledge, background, so that at least you might have a knowledge base around which to begin to approach the issues with which you live on a daily basis. So you see, it's got to do with if only I had known.
Okay, we'll welcome you back. So I mentioned that we're going to be talking about a different way of looking at things. It's going to be sort of a different perspective. And in one sense, it's a very subtle shift. In another sense, it's actually quite revolutionary, because we're going to actually be shifting paradigms. And we'll talk a lot more of that as the weeks go on. In the meantime, I just want to go back to if only I had known. And how important information really can be in education. If only I had known is actually, it's an expression of need. And in this case, a need for information, a need for understanding, a need for clarity, a need for reassurance. And often what you'll notice for needs, you never have one need by itself. It's usually connected to another need and another need. So if one need isn't met, then there's a whole pile of other needs underneath that are also probably not met. What I would like to invite you to do is imagine this entire course in the frame of need. And I think if you think about it, our socialization, our education is not focused on need. We're focused on what we're supposed to do, what our obligation is, what is up to us to provide. And very seldom, if you even think about your childhood, how many times were you asked, well, what do you need? And so oftentimes when I work with clients individually, and I talk to them about getting connected and getting clarity about what their needs are. And they'll often say, I don't want to do that because I'll make me self-centered. I'll become a narcissist. I don't want to be considered to be selfish if I look at my own needs. That wouldn't be a good idea. I've never, ever seen that happen. What I find is that we're out of balance, and usually it's out of balance in that way. That we are very good at helping other people meet their needs, but when it comes to our own needs, not only are we not often open for support, we don't even know what our needs are. So one of the things I'm going to be continuing to come back to is looking at putting both needs of other people and needs for ourselves on the table and starting to have an awareness of what our needs are. And so another word for need is value. It's what's important to you. So if we think about need in the context of chronic pain, what would that look like? What kinds of needs? Every person here, you're here because there's needs of yours that are not being met. And usually they're quality of life needs. So needs like energy, mobility, comfort. And I'm not going to tell you that every need can be met, because we all know that that's simply not true. However, even if a need can't be totally met, it's still important to be aware that you have the need. So awareness and clarity about the need is often the first step. Because I'll tell you one thing, if you don't know you have a need, the chances of it being met are 0. And so often, sometimes the need might not be totally met, but there's parts of that need, there's ways that that need can be addressed, even if it's not totally met. And again, that's not going to happen either if you don't have an awareness of it. So what kind of needs as a chronic pain can you relate to? Needs for energy, for primary relationships, mobility, energy for family. You relate to any of these? Concentration, energy for work. Sleep, we already talked about that. Mobility for exercise, sport, fitness. Anybody have any shifts or changes in that department since chronic pain? Yeah. And just energy for fun, entertainment. Even just the ability to have ease and comfort and peace. Sometimes when we have chronic pain, it's just not something that we're able to do. So if you can imagine that every action, every single action that every person ever takes is a strategy to meet a need. So we're going to talk about strategies to deal with grief and loss. Now, before we go any further, can anyone relate to the idea of grief and loss with chronic pain? In fact, all those things that we talked about, all those needs that were not met, how do you feel about that? That's a loss. And often, we don't understand how important it is just to be able to recognize that. When I talk about needs, something often people don't understand. I'm a bereavement counselor, so I deal with grief and loss all the time. And grief is not just one feeling. It's a whole compilation of thoughts and feelings. Mourning is the expression, and mourning is how we heal from grief. Mourning is a need. And often what people don't recognize that celebration and mourning are two sides of the same coin. So you can only celebrate to the extent that you can mourn. If I were to ask you, how do you meet your need for celebration? That's usually a pretty easy question for people to answer. Yes, connecting with grandchildren. You know, having wine, having food, maybe singing, dancing, all kinds of things you can imagine doing to meet a need for celebration. So how do you meet your need for mourning? What does that even mean? Cry, yes, cry. That's definitely one. Often, for most people, it's different for different people, but often it's a need for comfort. So how do you take care of yourself, basically? What do you do to meet your need for care, connection to yourself, comfort? Family and friends. Yeah. So there's all kinds of parameters to deal with that, and we're going to talk a lot about grief and loss next week and some of the things that can be helpful. I always come back to the idea that awareness is power, and that we have so many answers, we just have to have the awareness to know where to look for them. So next week we're going to talk about grief and loss. Sleep, for sure, has a huge impact on our quality of experience. The other thing besides bereavement that I do is communication. Communication is huge, and often what we don't understand is we often think of communication between people. And in your toolkit, you noticed, you want to have support. But I'm sure all of you have had the experience that sometimes the people in our world are not necessarily support. Sometimes there's people who are challenging, who are actually more of a burden than support. So communication is helpful. Communication is really important to understand how to connect with people. But to understand that communication starts with communication within your own head. And often, when people start looking at their self-talk, when they start looking at how they talk to themselves, they are amazed that they are often their own worst enemy. Sometimes what people say to themselves, they would never say to their worst enemy, but they're saying those things to themselves. Again, they don't have awareness that they're doing that. The last thing you need when you're having pain is to have somebody who's right in your body with you who's not on your side. So we're going to look at communication strategies. We're going to look at communication within yourself and communication between people. And again, self-management and balance. And quite honestly, when you have chronic pain or, grief in any respect, we often wear out our family and friends. They don't want to hear about it anymore. We need people who can relate. And sometimes having support from people who have a similar experience works much better than people who simply can't relate to where we are. So that's one strategy. We are living in a virtual world. And so we can have people who support us who live in Australia, but we're connected on Facebook or connected online, so we can get support that way as well. So you're saying if one of your needs is service, like massage and those kind of things, again, it's going to be brainstorming. And what you'll find is that something that can be a seemingly impossible challenge to you isolated, when you start connecting, and that's where you have support with friends, it's amazing the kinds of things that can come out of that.
Your point's well taken about the cost of some services that you may not be able to afford. So I just want to acknowledge that's a significant barrier for some people.
Yes, I think that's one of the things that I hope is going to be a subtle kind of 1-degree course correction for all of you, is to start to recognize how much power we have ourselves. And that, a lot of things we can do for ourselves, and when you start doing that, often it starts coming from outside. You start getting that kind of reflection. But thank you for reminding us. And so again, that's something that there's places where you can get support for that as well, whether it's online or whether it's with other people who are, battling with the same challenges.
Again, we want to acknowledge the challenge of doing exercise when it creates pain, and pain prevents you from doing exercise. We just want to acknowledge that paradigm that you've drawn to our attention.
Mm-hmm. And that can be the 1-degree course correction, that something that seems very, very difficult to do. As you gradually lose weight and have less and less weight on that joint, exercise becomes more and more possible and feasible for you. So it's a good case in point. Thank you. So again, every strategy is there to meet a need. Education and information about strategies to meet needs is basically what we're going to talk about, recognizing that you all have strategies already. And it's not about throwing the baby out with the bathwater. So we're not going to say, stop doing everything you're doing and start doing this. In fact, we're never going to tell you to do anything. We're going to invite you to be aware that there's things that you might want to try. And again, always checking in with yourself. And hopefully those are going to improve the quality of your life experience. And so again, the first strategy, and what you'll notice is that there's often connections between the different things that we do. So the very first strategy that we're going to talk to you about involves breathing, something that we all do. So we're going to have a fairly amazing demonstration of how breathing can affect our quality of experience.
My friend and my colleague, Dr. Lowe, is going to come down and he's going to demonstrate something for you. You'd think with a name like Francois Lowe, he's trying to be a Springbok rugby player.
Yeah.
While you're just relaxing and getting stretching, I'm just going to show you this little thing. This is going to be something I'm going to ask you to return to repeatedly. It's a visual about breathing slowly. And in a minute, he's breathing normally right now. He's not
practicing. Put that on now. He's going to be watching it. You better watch out. You can't watch.
So, as I said earlier, we are all wired by our brainstem to breathe at about 15 or 16 breaths per minute at rest. But this little thing that you're going to have to take home, this little thing has 5 seconds in and 7 seconds out. So you can learn, you've got the next rest of your life to learn how to do it. And you'll learn to breathe in for 5 seconds. Of course, you have to breathe deeper than normally, and out for 7 seconds. And that means you've done a 12-second breath cycle divided into 60, 5 breaths a minute. So you're going to reduce your breathing from 15, 16 breaths a minute to deliberately 5. Now, you can't breathe this way permanently because the minute you stop thinking about it, your brain will switch you back to automatic 15 or 16, thank goodness. But you will teach yourself, and if you did it for 2 minutes or 5 minutes, and we're going to do a demonstration on my friend here, and you're going to see how the power of slow breathing. And I'm just waiting for my friend's heart rate to stabilize. He was a little excited that he's settling down nicely. Now you see he's settling down nicely. I'll try not to bother him. He's just sitting there quietly. You can't even see him. He's hiding behind me now, you see.
It's all over the place.
He gets so excited. Look, he gets so excited. I'm trying to get this guy to settle down. Settle down. Not Francois. Be more serious this time. Enough of that levity, Dr. Lowe. So he seems to be stabilized. Now we're going to, not yet, in a little while we're going to ask him to do slow breathing. But first, we're going to ask him to do some simple arithmetic, like 10.
All right.
Take away 2.
8,
Multiply by 3.
24,
Take away 2.
22,
Multiply by 3.
66,
Take away 2.
divide by 2,
Yes.
33,
Multiply by 3.
99,
Add 44.
133.
Okay, stop. Now breathe slowly. We'll be quiet. Close your eyes, breathe quietly. Thank you, my friend. Thank you. Wake up now. Wake up. Now, this is amazing. This is truly amazing. You'll see that his baseline was stabilized out. And then we asked him some simple things like, 10 take away 2, multiply 3, and all of a sudden, his body, his autonomic nervous system responded immediately to the challenge of all these numbers. And his pulse went up immediately. Did you see that? You saw it live. That is it's a minimalist form of anxiety. He wasn't anxious, really, but his brain was taxed. He was suddenly grappling with numbers. We all get out of sight with except adding all these silly numbers up. But what you witnessed was an immediate hit by his sympathetic nervous system. He went into the very early phases of sympathetic control, fight or flight. The grizzly bear wasn't chasing him. Not quite that bad, but he was focused on those sums. And boom. But look what happened. So when you're anxious, that's what happens to you. Pulse speeds up. How many of you sat in the bathtub at night recognizing your heart's going fast? Common. So the sympathetic system tightened on him in the moment. It wasn't an hour later. It happened within milliseconds. And then we said, scrap that, breathe slowly. He immediately, and I'm going to explain this to you in the weeks that come, I'm going to explain to you why that happened. So you'll have the information and the knowledge. Because this is what you can do for yourself to modulate your own anxiety. And you watched him as live. You saw it. Not only did he bring it down within seconds, but you notice he stabilized out. And he was quite calm. We almost had to wake him up there. But this is the normal physiology of the autonomic nervous system. And we're going to talk a lot about the autonomic nervous system. So don't worry about what you don't know now about it. By the end of this course, you'll be experts at it. But pain, to some extent, maintains a sympathetic tightness and a hold on people. So we live between at the extreme, fight or flight, sympathetic control. And on the other extreme, we talk about rest, relax, and digest, the parasympathetic control. And here you see him in a little minor sympathetic control, and you see him very quickly in good parasympathetic control, within seconds. And we're going to teach you by the end of this course that you can do this anywhere. You could do it in the lineup in Safeways. You could do it in the doctor's office waiting. You see, I grew up in the African sun, and I was exposed to sunshine that I didn't realize in those days was bad. So I grow cancers on my face all the time. And so I go along and I visit my local friendly plastic surgeon, and he takes one off here and another off there and another off there. Anyway, I went off to get one taken off my ear about 6 months ago. And I went into the doctor's office, and the nurse came out very agitated, and she said, "Oh, my dear, we're 40 minutes late." Have you ever had that experience? I said, "Don't worry about it. Don't worry about it. She's got something to read." I said, "No, I don't need anything to read. 40 minutes is not a problem." So she went away, and I thought, well, this is my opportunity to breathe slowly for 40 minutes. So I've trained myself to breathe at 4 breaths a minute. Ooh. You can too, and maybe by the end of this you will. So anyway, I sat there quietly, and I breathed away at 4 breaths a minute for 40 minutes. A little while later, the nurse came back, and she says, "Oh, dear, we're ready now. Sorry to keep you waiting." I said, "Oh, no problem." So she came by, take my blood pressure, you know the way they do. And she took the blood pressure, and I could see she didn't believe what she was looking at. So she didn't look up. I watched her. So she stepped back, and she pushed the blood pressure cuff again. You know how they do. And when she didn't believe the second reading, she didn't look at me. She took the blood pressure cuff, took it away, brought another one in. She wrapped it around my arms. I was watching her all this time, watching her face. And she went like this. She looked at me and she said, "Okay," she said, "what drugs are you taking?" I said, "Well, actually, I don't take any drugs at all." She said, come on. You're taking something, aren't you? I said, "No." She said, "You've only got a blood pressure of 110 and a pulse of 50. I mean, what are you taking?" I said, "Nothing." She said, "Well, what have you been doing?" I said, "I've been slow breathing at 4 breaths a minute for the last 40 minutes. She said, "You got to be kidding. Come on, let's get this case up." She didn't believe me. It's the truth. You can train yourself to do that. Now, Buddhist monks, for the last 2,500 years, have been able to slow their pulse rate to 45. And we haven't believed them until now. And by the end of this session, I'm going to show you research evidence that proves that the Buddhist monks were correct. Anyway, thank you, Francois Fernand.
There's something about seeing a demonstration that graphic. I've known this forever as well, but having seen this again in the last one we did, it really does bring it home that just something as simple, you talk about 1 degree course correction, as simple as slowing your breathing down for a couple of breaths will have a dramatic effect on your physiology and your experience. So, it's something very subtle, very simple, and very doable.
So, Francois, how did you feel? Put your button on there. How did you feel during the moment of your mathematical confrontation?
Oh, like a deer in the headlights, I felt like I'm going to get caught out. I'm bad at math. I'm terrible. I'm going to screw it all up. And I sort of just felt like that fight or flight response.
Yeah.
So I felt, really just mini, sort of a micro period of stress. So I could feel my heart rate go up.
You could feel that?
Yeah.
So then you went into slow breathing mode, and he's trained himself to breathe slowly. So how did you feel after 2 or 3 minutes of slow breathing? What happened to you?
Oh, really relaxed. I think I could have done even more. I could have slowed it down even more. I think one could train yourself. I haven't actually done as much training as you have, but I just felt so much more relaxed and just more in control and comfortable.
Well, thank you so much for...
Thanks.
That's a good question, and the answer is yes, because what we haven't taught you yet is that your heart rate is opposite to what we call your heart rate variability. And believe me, you'll know all about that at the end of the next 6 weeks. So your heart rate variability is your measure of health. When his rate went up, his variability went down. He was threatened. And when he went into a rest state and his pulse came down, his variability strengthened. So getting to your answer, thank you for the question. The answer is, if you are angry, your heart rate variability will go down, your anxiety level will go up. If you are depressed, it'll happen. So this measure is a measure of general health.
To address the anger, if you remember what we talked about, his story, how anger and fear are connected. And so fear is on the continuum with anxiety. So whatever anxiety he was feeling around doing math is fear, and it's connected to anger. So we often think that our feelings are very distinct and separate. They're not. They're connected to each other. And fear and anger are very closely connected. I'm going to do, again, next week I'm going to talk about anger and give you some other insights about that. And anger is one of the most misunderstood feeling that we have. It's also one of the most valuable emotions we have. So, good question about anger.
You will be able to, in 10 weeks' time, modulate your immune system just the way my friend Dr. Lowe did today. And he did it without any practice. He just came up and did it. He's never done this before. But you will learn the tricks, I hope, that will help you do that. I'm going to go into this in a lot of detail towards the end of this discussion. But this is 2014 scientific evidence. It's hard data. It's evidence-based medicine. And they've shown you that breathing at a rate of 5.5 breaths per minute increases your heart rate variability. You just saw it. You just saw a live demonstration. And now we actually have scientific publication, data 2014, that proves that to be correct. What you just observed has been shown. So if you go to your little breathing pattern at 5 breaths a minute, and I can tell you, if you can maintain that for 10 minutes a day, every day, for the next 8 weeks, 10 weeks, you will improve your heart rate variability and your health. There's another bit of evidence I'm going to give you, and we're going to go into this in a lot more detail in sections down the way. So I'm giving you sneak previews as to what's coming. But when we teach you about mindfulness and meditation, we're going to tell you about John Kabat-Zinn. He's the founder of the mind-body medicine movement in the modern era. And we'll talk about this in a lot of detail, but I'm giving you this information today. I'm sneaking a little preview. This is a publication by Zinn, and he states that there are alterations in brain and immune function produced by mindfulness meditation. And he's talking about mindfulness meditation, so-called mindfulness-based stress reduction programs, yoga, imagery, relaxation, slow breathing. Now, this is the commitment we're going to ask of you. It takes time, 1 degree course correction. This doesn't happen overnight. You can modulate yourself in the minute the way Dr. Lowe did, but if you want to build a permanent change in your immune system, and we'll explain that to you, you have to do this every day for the next 10 weeks. And if you do, in this publication, 8 weeks, these changes were measured in patients, but it requires daily participation, and this daily activity becomes a lifelong habit. We have habits that we do every day. We brush our teeth. We have supper. We go to bed. These are daily things we do. All you have to do is be committed to doing something along the lines that we will teach you in the next 6 weeks that you do every day. And this is the evidence that proves that it will work. There are skeptics among you, and there are skeptics in the community out at large, but little by little, scientific evidence is now beginning to catch up with practice. So, to wrap today's session up, thank you for coming. Thank you, Revelstoke. Thank you, Enderby. Thank you, Dr. Lowe. Danny and Linda, thank you very much. We'll see you all this time next week, 1 o'clock next week. Mary Ellen?
Mm-hmm. Yep. Just focus on 1 degree course correction. That's going to be our motto for the next 6 weeks. So looking forward to seeing all of you next week.